we were together in Saba during the Zika outbreak. There was also in 2018, the Ebola outbreak in the Democratic Republic of the Congo, and then the one today, which is what we're dealing with, the COVID-19. And here I want to say that the important message is that this was a reluctant choice and alert by the head of the Director General of the World Health Organization. For me, he's the unsung hero of the COVID-19 pandemic, in that Dr. Tedros Adhanom Ghebreyesus alerted the world that we were in a pandemic that was initially called 2019 COVID-V by the WHO, and then officially named SARS-CoV-2 by the International Committee on Taxonomy of Viruses. It's very important that you understand how this role of epidemiology was such. And there's also further indication that when they started to look at data worldwide, it was epidemiology science, excuse me, that told the world that there are mental health problems associated with COVID-19. And this is to pick up from the wonderful panel that we had yesterday afternoon that was moderated by Dr. Bansal and featured Dr. Devendra Sharma, Dr. Raghu Raghavan, Dr. Nadia Suridentka, and Mr. Niaz Subhan. And I want the attendees to take that as a bridge to what I'm saying today. So the first point is that there was a high burden of mental health problems, including, and these are some of the mental health issues that were discussed exclusively in yesterday's panel and yesterday's presentations on mental health: depression, anxiety disorders, stress, panic attack, irrational anger, impulsivity, somaticization disorder, sleep disorders, emotional disturbance, post-traumatic stress syndrome symptoms, which is often called PTSD in the English-speaking world, and suicidal behavior. This was one of the things that was emphasized by Dr. Bansal, the program chair, when he talked about the significance of choosing this as a non-communicable problem for the entire Caribbean region. We continue with the epidemiologists who told us that there were several factors that were associated with mental health problems in the COVID-19 pandemic. And these included age, gender, marital status, education, occupation, income, place of living, close contact with people with COVID-19, comorbid physical and mental health problems, exposure to COVID-19, comorbid physical and mental health problems, exposure to COVID-19 related news and social media, coping styles, stigma, psychosocial support, health communication, confidence in health services, personal protective measures, which everyone's calling PPE, and risk of contracting COVID-19, and last but not least, the perceived likelihood of survival. So here you can imagine that people are getting information from all of these sources and affecting various groups to which an individual may belong. And here they make the suggestion that the only thing that will help with, first of all, that we need the attention of the entire global health community, and that the multi-pronged interventions, which is what was detailed by yesterday's wonderful mental health panel, that there should be multi-pronged interventions developed and adopted to address the existing psychosocial challenges and promote mental health amid the COVID-19 pandemic. And one takeaway that I did, because I was taking lots of notes on yesterday afternoon's panel, it has to be adopted and modified to fit the situation in Guyana. So one of the publications from the United Kingdom, which was a multi-authored presentation last year, is titled Psychiatric and Neuropsychiatric Presentations. And here, what they did is they tried to compare two previous outbreaks. One is severe acute respiratory syndrome, or SARS, which began in 2002, and the Middle East respiratory syndrome, MERS, which started in 2012. So they wanted to compare the psychiatric and neuropsychiatric presentation of these three pandemics. And this slide emphasizes what I've already said, but I want the attendees to pay attention. The time of origin, December 2019. We are now almost a year and a half after this. The place of origin, Wuhan, China. And unfortunately, you'll see later on that the world got distracted by arguing about where this came from. Confirmed cases when this was published was the highest in the United States, 843,937. More ominous is that the United States had the highest death rate, 46,838, which was 5.54% of the US population. And it's gotten worse. Here is a summary of two of the studies where they reported acute psychiatric and neuropsychiatric outcomes of SARS and MERS infections. And here, what I want you to do is to pay attention to the countries that are reporting. So you got the United States, where they were having, in a pregnant woman, symptoms of anxiety. In Canada, and I'm trying to emphasize the North American continent because that's most relevant to my practice experience, and I'm talking to you from Atlanta, Georgia, in the United States. Again, anxiety, confusion. I want to go back up to the 2004 study coming from Hong Kong, and here they're talking about SARS-CoV, and they're saying the diagnoses, and you see the list without my repeating it. It's exactly the same mental health issues that were described earlier. So it's epidemiology that's helping to guide where we go. On the bottom, Toronto, Canada, again, symptoms. Key ones: insomnia, anxiety, exacerbation of panic disorder. So what I want you to take away from this slide, and it looks very busy, but you only have to focus on two sides, and we'll do it one at a time. On the left-hand side, it says the acute psychiatric and neuropsychiatric syndromes associated with acute illness. Number one, insomnia. Number two, anxiety. Number 3, impaired consciousness or attention. Not to be ignored is suicidality, which is something that was highlighted in yesterday's mental health panel. I'm going to come back to fatigue because this is turned out to be one of the most important symptoms of the post-illness development, and I'll tell you something special about post-illness. The last thing I want you to take away from this slide is where it says frequent recall of traumatic memories, and you see that it's 30.4%. So it's a frequent problem, and this is what most people call PTSD. So one of the hallmarks of the acute confusional state or delirium is that there are some clinical features which are highlighted, and it's primarily fever, headache. There may or may not be seizure. But at the bottom, I wanted you to see that there are primary psychiatric conditions that can present with acute confusion. And this is where there has to be the kind of marriage of professionals that Dr. Devendran Sharma, I'll call him Sharma so that I don't spend time, but Dr. Sharma was talking about the collaboration between neurology and psychiatry. And as a person who is board certified by the American Board of Psychiatry and Neurology, it emphasizes the role of these two specialties and how they have to collaborate to improve the care given to patients. So what's to be interpreted from all of those numbers that I showed you? Number 1, SARS-CoV-2 may cause delirium in a significant proportion of patients in the acute stage. So that healthcare providers need to look out for that. But they also ought to be aware of the possibility that there are mental health problems. And again, this is a direct carryover from yesterday afternoon's panel. Depression, anxiety, fatigue, PTSD, and other neuropsychiatric syndromes. So you may have noticed that a lot of the slides that I've done so far keep referring to this wonderful study in publication in 2020. That's the Psychiatrica Danubia, which is coming from Croatia. And the first author, Dr. Jakolovich, does a wonderful review. And so I would say to the students, the residents, and the faculty, if you had to read one paper about this entire problem, I would read the 9 pages of this wonderful article, and I would keep it and I would review it over and over, because each time I read it, I learn more about the issues. It predicted that the next wave of infections, and this is almost like deja vu, would be in Africa and Latin America. And here's the problem. Many countries who didn't follow the WHO recommendations, and remember I said that to me, Dr. Ghebreyesus from the WHO is the one who should be given the credit for trying to help the world to deal with this 6th PHEIC. The clear recommendations from the WHO are: number 1, widespread testing; number 2, quarantine cases; number 3, contact tracing; and number 4, social distancing. You've got to do that. And as Dr. Fauci, who is the expert here in the United States, and the reason that I'm saying his name and giving him honor is that he is the American scientist as the head of National Institute of Allergy and Infectious Diseases at NIH, who has been with the United States leadership throughout all of those 6 pandemics that I've described. And so he's the one that we should all be listening to, as well as Dr. Ghebreyesus from the WHO. Now, the WHO says that there are 10 things that you have to do to successfully communicate among all of the different countries. Number 1 is build trust. The one that I emphasize is to use social media as appropriate. And here I criticize the social media in the country where I'm talking from, which is United States. And it's a caution to the social media in Guyana, which is what was sort of highlighted by Mr. Subhan yesterday afternoon, who, as the only non-physician, made some wonderful insights about how this should be viewed, how we should participate. The other one that I think is important is to trust emergency risk communication as a strategic role. And the last is build capacity for the next emergency. What have we learned to date? And what can we do first to get through this, but also to avoid some of the unfortunate associations? And what I've highlighted is, number 1 from this table, that there have been political and economic competition. And unfortunately, and you see at the bottom, it's the conspiracy theories that have caused so much disharmony among healthcare providers worldwide. Number 2, yes, we need to quarantine infected individuals, but we have to be careful as to how we quarantine entire communities. Table 2, what can we learn? What's the point of going through this if there aren't things that we can learn? And we can learn particularly the second bullet here, transdisciplinary integrated science, fancy word for multidisciplinary participation. The other is to make tests both extensive and affordable. And unfortunately, United States is late to this about affordability. And you've got to trace and isolate and practice early physical distancing. Number 2 is optimism. And this is where I turn to Dr. Fauci. He continues to say on our social media, we're going to get through this, but we've got to continue to do those public health measures. Now, here's the problem that I hinted at. They're now finding that there are individuals who do not recover fully from COVID-19. And this is a picture of a gentleman in Italy who is doing his best to keep up with the fact that he's still having respiratory trouble several months after he has recovered. And again, it was the epidemiologist working with a radiologist who identified this problem. And so, again, Dr. Fauci here has now given a label to this problem. It's quite frequent, and the particular report earlier this year in March was that as much as 30% of the people with COVID-19 symptoms persist for as long as 9 months, and they suspect that it may be even longer. So for reasons of communication, it's now labeled PAST, and that stands for post-acute sequelae of SARS-CoV-2. I'm a board-certified neurologist, and so we just had our American Academy of Neurology meeting virtually, just like Texila is doing. And they had an entire plenary session just on this issue. This is what all of the scientists are now talking about. And I want you to know that the key symptom of this PASC is fatigue. Fatigue. But number 2, GI problems could be abdominal pain. Number 3, mental health issues. This is why I congratulate and give kudos to Texila. Okay? They have recognized that mental health problems can be at the forefront of the pandemic, and unfortunately, they are the number 3 associated symptom in the recovery. And I'm almost finished, and I'm sorry about the delays. So Dr. Bansal put the panel yesterday as to what are take-home measures. What can we learn from this? And the first is what I have learned. And what I've learned is that knowledge is telling the past. So we have to document what happened and the sequence. Now the hard part, wisdom. What wisdom have we learned, and can we predict the future? What I would assume, what I want the attendees to know is that mental health sciences are the most effective way of preventing and overcoming epidemics and other global threats. And this was wonderfully laid out by all of the speakers in yesterday's mental health panel and their presentations. Here is a sort of rhetorical question. At the end of the day, what have we learned from the pandemic? And this was an article in the Columbia magazine late last year. And you see the fingers of the hand, okay? So you've got spread, you've got fever, you've got global involvement, you've got a pandemic, you've got contagion, you need to do quarantining. And here is the scientist, Dr. Ho, and his associates who said, listen, we need to stop what we were doing. We were well funded with AIDS in terms of research. He said, no, we need to drop everything and try to figure out how to help the world get over the SARS-CoV-2. Second take-home message, when will it end? We don't know. But the only hope that we have is that enunciated by Mr. Kofi Annan, who was the head of the UN for a while. It says you have to have cooperation. You have to have partnership. That's the only hope. So we have to know the truth. We have to avoid falling victim to propaganda and misinterpretation. What we need is resilience. And what are the carefully planned steps? And what Dr. Fauci and the people here in the United States have been saying. Keep COVID from entering your facility. Restrict all the visitors. Restrict all the volunteers. Actively screen anyone entering your building. And you're particularly looking for fever and other symptoms of COVID, like headache or shortness of breath or non-productive cough, okay? And if somebody is sick, send them home. They cannot help the situation if they are themselves affected. And cancel all trips outside of the facility. So if you have a secure facility, make sure that you get the people inside taken care of. So to conclude, we have to know about facts. We have to know about facts in a time of anxiety, facts in a time of misinformation, facts in terms of division. As I said, the whole world is split in terms of distraction about where this came from and what caused it. In a time of crisis, we are in a mental crisis that's global. Facts. Facts first, and the truth matters most. And I end with my hero. And here it is, Dr. Ghebreyesus, and they use Dr. Tedros, I guess it's easier to say. He said that we have to leave no stone unturned, explore all the options for increased production of the vaccines. And this is not a focus of today's conference, but you know that there are currently 4 vaccines, and there's questions about safety and efficacy, etc. And I repeat what Dr. Tedros is saying: no stone unturned, explore all the options. And the last is that we're now finding that even some of the people who are vaccinated will get infected. So it's another wrinkle. So I appreciate you listening to my views and my review of the current literature. And I wanted to highlight this before I get off the mic. In 2007, I returned to Guyana as one of the speakers and physician treaters after I had been away from Guyana for 45 years. 45. And it was led by Dr. Claudette Thomas, Helga Thomas, who's a pediatrician here in the United States, and she's doing something called Building a Bridge. And it's her vision that I endorse and I support. And we will be coming back in November of this year. The key to getting through this is continuing medical education. And I salute Texila for making this program and these 2 days continuing medical education. That is going to be the, forgive the religious reference, the salvation for the whole world trying to get over SARS-CoV-2. Finished, and if there are any questions, if we have time, and I have not completely disrupted things for the conference.